my name's Dr. Jeremy McAnulty from New South Wales Health, and I'm here with a COVID update for Tuesday the 11th of January 2022. Across New South Wales, 95.1% of people aged 16 years and over have received their first dose of COVID vaccine, and 93.7% have received 2 doses. Of the people aged 12 to 15 years, 81.5% have received a first dose and 78.1% have received 2 doses. There are currently 2,186 patients with COVID in hospital in New South Wales, with 170 people in intensive care, 51 of whom require ventilation. There were 25,870 cases of COVID detected by PCR testing reported in New South Wales in the 24 hours to 8 o'clock last night. More than 71,000 COVID tests were reported during the same period. As increasingly people follow New South Wales Health's advice to use rapid antigen tests for diagnosing COVID-19, the number of PCR tests will underestimate the true number of people who've tested positive for COVID-19. Sadly, New South Wales Health is today reporting the deaths of 11 people with COVID-19, 6 women and 5 men. 7 people were aged in their 80s, 3 in their 90s, and 1 person was aged in their 70s. Of the 11 people who died, 9 were vaccinated and 2 were not vaccinated. We'd like to express our sincere condolences to the loved ones and families of the people who've died. If you're under 65 years of age and have had 2 doses of COVID vaccine and do not suffer from any chronic conditions and are not pregnant, you can safely manage COVID at home. If you're pregnant or have chronic medical conditions that require regular hospital visits or specialist follow-up and are feeling unwell, please call the New South Wales COVID-19 Care at Home support line or your local doctor. If you develop severe symptoms, particularly severe headaches or dizziness, difficulty breathing, chest pressure or pain, please call 000 straight away and tell the ambulance staff that you've been diagnosed with COVID-19. A reminder to everyone across New South Wales to get vaccinated now if you haven't had your first dose, and to get your second dose and booster shot as soon as they're due. Yesterday, New South Wales Health, along with vaccination providers across the state, began administering COVID-19 vaccine to children aged 5 to 11 years of age. If you're a parent or caregiver, we encourage you to make a booking for vaccination at any New South Wales Health vaccination clinic or through your GP or pharmacy. New South Wales booster program continues to ramp up as more people become eligible, with New South Wales Health already having delivered more than 351,000 vaccine booster doses to help keep people safe and increase the level of immunity in the community. We urge people aged 18 years and over to get their booster shots as soon as they're eligible, which is 4 months after their second dose, to best protect themselves, their loved ones and the community against the ongoing risk of COVID-19. We also strongly recommend that people aged 12 years and over who are severely immunocompromised have a 3rd primary dose of vaccine 2 months after their second dose. So please remember to follow those COVID-safe behaviours, including wearing masks indoors and washing and sanitising your hands on a regular basis. And also, if you're unwell, please protect others. Don't go out to work or socialise or go shopping. Get tested and isolate until you get a negative result. So thanks very much, everyone, for coming forward, for getting vaccinated. Don't forget to book those booster shots or to book your vaccine for your children right away. Thanks very much, everyone, for keeping us all safe.